First of all, thank you, Dr. Rosen, for inviting me. My name is Sunil Agrawal. I am a roboticist by training. I've been working here at Columbia within both the School of Engineering as well as School of Medicine. I have joint appointment in engineering and medicine. The stuff that I will talk to you today is about rehabilitation robotics. And some of the goals of our laboratory is to look at human movements in daily life, right? If you think about everyday tasks that we do, whether it's walking or standing or turning our body or reaching out for things, many of us in the audience, we can do that almost routinely without having to think about it. But we know that there are people who may have impairments and have difficulty doing these same movements, either because of just the age, or it could be various neurological issues and so forth. So the challenge that we look into in our laboratory is how robotics and technology can help to kind of bridge that particular gap. And so just to kind of give you a little background of robotics, I think almost all of you would be familiar with aspects of robotics that you have seen on television or in your life. We know that robotics initially grew to support industrial automation, and the use of robotics in medicine is relatively recent, roughly about 25 years or so. And we know that surgical robotics is a very, very advanced field. Many times, I think some of the surgeries are done using robots. And we have also seen pictures and videos of prosthetic devices, people who cannot walk, and they're able to use the machine as a way to add on that missing limb. However, my talk today is about rehabilitation robotics, and where the goal is to use robotics and sensors to retrain functional movements or to characterize functional movements about your daily activities or tasks, whether that is in occupation, whether that's in our daily life. I mean, we would like to characterize them and if possible, to improve them. To just kind of give you an understanding of what rehabilitation robotics could mean is, think of a child who's learning to bike. Often when these children are learning to bike, we use training wheels on the bicycle, right? And those training wheels work out very good because the child doesn't have good balance in the beginning, but slowly they kind of develop that balance. And as a result of it, they are able to develop that skill set, and they don't need that training wheels on their bicycle anymore. And we think of rehab robotics as those training wheels that can guide functional recovery after neurological, orthopedic, geriatric, or other medical conditions. So let us think of simple functional tasks in our daily life: sitting, standing, walking, climbing on stairs, reaching for objects, turning our head, interacting with others. We do these tasks many times during the day. We take these for granted that most of us can do these effortlessly. However, consider someone who has had a recent stroke or a spinal cord injury, or someone with an old age. These simple everyday tasks can become a challenge for them. And our goal in our lab is to use robotics, which may be worn by humans as external devices or orthotic devices. And these devices have the ability to both sense as well as apply restorative forces on the body based on physiological data from various sensors that you may be wearing on the human body, whether that's electromyography, whether that's movement data captured from cameras, or other kinds of sensors. And the human body and the robot basically work symbiotically for both sensing and feedback. So a lot of what you will hear today is in the context of functional deficits because of medical issues, but these are all dual use technology, right? So that can also be used to improve the function in your daily activity, right? So you can either improve the function that you normally have as a healthy individuals, or you can sort of use this to train or better a certain function that one has lost. So here are some visuals of robots that we have designed and tested in Columbia Road Laboratory over the years. To retrain walking on a treadmill, we have designed a device called T-pad. And this system applies control forces on the pelvis during walking. And for walking over ground, we redesigned this T-pad with a mobile version of it. We have also various versions of this T-pad kind of to help understand why people have compromised balance during walking on stairs. And we'll show you some more details in my later slides. Now, this device here called Robust, it is a stand training device. Okay, and you may be wondering, why is it even important for us to think about standing, right? Because we can almost all of us do that well. But think of old age or somebody with a spinal cord injury, that simple task of standing may become quite compromised. Also, if you think about standing, it's not just being in one configuration, but also respond to various kinds of external or internal perturbations that come to you. And you get to basically use corrective actions that has to come from your neuromuscular system to counteract that and still maintain your physical activity. Out here is called the Deep Sole. This is an instrumented shoes with embedded sensors that measure pressure, acceleration, and orientation of the foot during walking. And again, this could be quite important whether you are doing kind of leisure activities or you are kind of walking inside home, or as an occupational worker, you may be kind of doing tasks that are required for you to do in your environment. These shoes, I mean, we collect a lot of data from these shoes, and we can use some of the data sciences or machine learning, some of the deep learning to understand what are normal patterns of movements and what are sort of compromised patterns. And these things can essentially then guide us for future interventions. Out here on the right side is the various studies that we do in our laboratory looking at how do you improve sitting reach, right? So we know that your core strength comes from your trunk. And if you have deficits in the ability to move your trunk around, that shows up in many of your functional tasks, whether you are kind of reaching for things or keeping yourself on the couch, kind of looking at television, or preparing food and feeding yourself. We have other devices and technologies. For example, we know that your head, neck, or your upper body posture is very important, especially in our office work, or we are kind of looking at computer screens, or you're looking at your cell phones. We know that the control of the head, neck is very, very sort of important because all of our sensory system kind of resides in our head. And the inability to control your head motion then affects many of these sensory system, as well as there are people who have got head drop because of diseases like ALS. And some of the motivation for these was to sort of create devices or systems that can both characterize as well as train them. So a lot of what you see in my slides are technologies. I mean, they are popularly called exoskeletons. And these are devices or systems that are put around the human body, and they can basically either characterize, they can sense the movement, or apply external forces in the body if that is required for assistance or training. So, of course, I mean, in this limited amount of time, I will only touch upon a very few videos on some of these. But the general idea is that these exoskeletons can be designed for various movements that involve parts of your body, and that could be fed either externally through sensory data, or they can be controlled with measurements of the physiological signals within the human body, such as your muscle EMGs, or maybe your eye movements or your force sensors that you apply from your feet. So let us first ask the question, why robotics and how it can complement recovery after a medical condition? Okay, as we talked about, some of the robots have sensors that can assist and quantify functional tasks, and these could perform a role similar to questionnaires to characterize impairments. Often when we go to clinical care, we have a variety of questionnaires that we fill out, and those are, a lot of the answers are subjective, but that could be augmented with objectivity using the sensors that are there mounted in these devices. Now, also robotics can help retrain movements by modulating forces or motion on the human body segments. And the goal is to do this effectively and efficiently and provide a novel tool to physiotherapists and clinical personnel to improve these functions. Now, robotics can be used to place the human body also in new environment, and that way you can see how human reactions and responses could change, and that will also sort of help us understand how close are they to certain effects due to these medical conditions. So, so in order to motivate this, I want to sort of show you a video here. I hope, and maybe Dr. Rosen, if you can sort of confirm that you can see the video on the screen.
Yep, could see it.
Okay, wonderful. So what you see here are stroke patients, and this is a study that we did while I was at University of Delaware. This was a funded project from the National Institute of Health. And many of the stroke patients have a residual gait deficit. And of course, stroke is a one-sided impairment. I mean, you get a weaker side and you have the healthy side. And what we were trying to do here is to improve the walking and creates a more symmetrical gait and balanced gait for these individuals. And in these videos, what you see is a stroke patient who is wearing this exoskeleton, and that is connected to his weak leg. In this case, video is the left leg. And the individual, of course, he has a gait trajectory, and the goal is to sort of improve that trajectory and make it more symmetrical in line with what is there on the healthy leg. And this, of course, cannot be done in a single session, but you do this over multiple training sessions where the robot is looking at the trajectory and applying forces on the foot, just like a physical therapist would do to manipulate and retrain the gait. And of course, I mean, we challenge the individuals. We can change the way the forces are applied. We create these force tunnels. And in the beginning, those tunnels can be large, and then they could be change in diameter as well as the force. So there's a lot of parameters that you can do, which let's say a physiotherapist is able to sort of kind of use their experience to do some of that. But you can see here that those are all very labor-intensive things. But with the machine, you can sort of characterize and help them a lot better. So the videos, let me kind of see if I can play this video again. And you can see here in the video, these are videos where this is 1 month follow-up video. And you can see that the person is walking a lot more stably. They can walk faster. They have larger step length. They have a better knee flexion that is not there in the previous video. But these are on the exoskeleton. But if I were to have them walk over ground at self-selected walking speed, and we know that the walking speed is very well correlated in terms of their health and being able to sort of perform their daily activities. And you can see that in the beginning of the training, okay, that's given by this yellow bar, and the blue is right after 12 sessions of training over a 3-month period. Okay, but even more interesting is the gray bar, which is 6-month follow-up. And in those 6 months, the patients went home. We encouraged them to walk and kind of take walks as much as they could. And they came back, and what you see here, that they actually improved their walking speed even after they finished their training with the device, right? And that's sort of, and this is a group data with 9 stroke patients, and this is a 6-month follow-up data. And what it tells us is that there is a potential for these stroke patients to improve their gait and be able to sort of keep that even later. So that is sort of the perspective that these devices and machines can be used in these different scenarios. So what I'm going to do here is, I know that we are, so I want to sort of show you a video, and this is more to looking at how people can improve their balance. And we know that many of the countries, many of the different society kind of use Tai Chi as one of the ways of improving balance. But what we are trying to do is we are giving controlled perturbation on the different parts of the body. So those of you who take train to commute, you can sort of correlate this with the train shaking, and you have to sort of keep your balance. And we did a variety of studies to see how this can improve balance in people. So I would let this video play here.
It looks a little like Harry Greenwald is getting ready to go skydiving or maybe bungee jumping. But this is actually part of a study to prevent potentially serious falls. Very important because Harry has Parkinson's.
There have been times when I could feel my forward foot not quite grasping the next tread on the stairs, and there are times when we're walking down the sidewalk I have to remind myself, for posture issues, I should be raising my head and looking ahead because Parkinson's has got me looking down a lot.
40% of people over age 65 suffer a fall at least once a year. That number is much higher for people with Parkinson's because the disease affects their gait and balance. So Dr. Sunil Agrawal at Columbia University has devised a system to teach Parkinson's patients how to keep from falling by training them to recover when this elaborate contraption tries to disrupt their sense of balance.
We give them the experience of being able to recover better from this momentary loss of balance and be able to train their neuromuscular system to be able to be more responsive when a fall appears.
In fact, Dr. Agrawal's study showed that just one training session substantially improved Parkinson's patients' balance and ability to avoid falls. The harness prevents Harry and others from actually falling, of course, and the better they get, the stronger the jolts come, and from different directions. Although Harry had to learn to trust the device.
I relaxed a little and said, okay, I'm not really going to hit the ground here. Hey, it works. The harness really is going to keep me up.
Now, Harry says he's more confident now walking and especially going up and down stairs. The balance disruption system is just at Columbia for now, but it could be rolled out to other medical centers. You only have to prevent a couple of serious falls in Parkinson's patients to make it all cost effective.
So, so we have a variety of projects in our laboratory, and this is a clinical trial that we are doing with the funding from the National Institute of Health, how to improve postural control in children with cerebral palsy. And of course, this can also be done with individuals who have a spinal cord injury. And we recently published a case study where we have this individual with spinal cord injury. He doesn't have the ability to move his trunk very well. He has got ability to move in certain directions better than the others. And what he's being trained right now is to improve his ability to control the trunk and get back to neutral in different directions around him. So think of, let's say, reaching forward, sideways, backwards, or in 45 degrees. And what this training basically did for this individual, if you see this little inset up here, for example, at the beginning of the training, he was able to move forward, but not as much laterally. But by the end of training, he could sort of improve that workspace, which is comfortable around him, to almost improve by 400%. And this, of course, translates into a lot of different activities like taking off a T-shirt and putting it on and off. And this is a standardized test that is there in the community. So we look at, in the interest of time, I'm going to sort of look into another project here. This is a look at head-neck movement. We know that in a lot of industrial space, the ability to, we have doing these repetitive tasks that require the head and the neck to move in different ways. And some people have issues with that. And here we are also looking at individuals who have a head drop because of disease. And in this case, these are exoskeletons that can be used to help people kind of regain that mobility and train them. This is a video of a patient with ALS who is unable to move his head, neck, because he doesn't have enough strength on his external muscles in the and so with the help of this device, he's able to follow certain movements on the screen, but otherwise he would not be able to do that. And again, this could be a very valuable tool, especially in occupational area where a lot of repetitive tasks have to be done. So, so I know that we are running sort of close to the end of our allotted time. I want to sort of stop here, but I'll encourage you all to take a look at our laboratory and see if there are ideas and technologies that can be applied to your space, where we are looking at human workers and how these technologies can be used to improve their daily function. So I'm going to stop.